Hello and welcome everyone. Today we are getting into preparation for heat and sun, as well as prevention and treatment of heat and sun related illness and injury. Okay, so that's what we're covering today. This will cover what to wear, what to bring in your bag, the common sun and heat related injuries and illnesses, the symptoms of them, the treatment of them, and what we do and do not recommend in terms of common folk and herbal remedies for such. Now, as a reminder, street medics are not legally protected if they use over-the-counter or prescription medicine to treat any of their patients. What you use on your own body at home, that doesn't matter, but what you use for someone on the street, that might have to matter in terms of you getting sued. Now, I always think you should prioritize ethics over legality, so you get to make your own choices. But we're going to cover some of the really common herbal remedies that get suggested as treatments for these conditions, and what does and does not work according to clinical studies on the matter. Okay? Everyone good with what we're covering today? And then if you can stick around after the slides and the lecture, I've got a table set up over here to show you how I make the thing that I stock in my kit. Alright, let's get started. As global temperatures rise, summers lengthen, and heat waves occur with greater frequency and severity, it is crucial to be informed about how to handle exposure to hot temperatures. People need to know how to dress, what to carry with them, and how to prevent and treat heat and sun-related illnesses. Hot, humid weather, clothing, and gear. Before getting into... What, honey? Yeah.
Okay.
Before getting into clothing and gear recommendation, let's talk about wet bulb versus dry bulb temperature. Wet bulb refers to the method of measuring air temperature where the thermometer is enclosed in a water-soaked cloth, which measures how much water vapor the atmosphere can hold at the current weather and air pressure conditions. Dry bulb temperature refers to the measurement of ambient air temperature and is the temperature of outdoor air as measured by a standard thermometer. Wet bulb temperature is a measurement that accounts for both heat and humidity. Water can only evaporate if the surrounding air can hold more water. When the relative humidity of the air is at 100%, the air cannot take water off a human body. Evaporation is needed for sweat to be able to lower the human body temperature. If evaporation cannot occur, the human body overheats, and this can be lethal. A wet bulb temperature above 90 degrees Fahrenheit or 32 degrees Celsius is the limit for humans to perform any outdoor activities. Even when not being physically active, humans cannot survive more than a few hours beyond 90 degrees Fahrenheit wet bulb temperature, even with unlimited water and shade. So if you are at 90 degrees Fahrenheit and the humidity is at 80% or higher, you could just die in 2 hours. It doesn't matter if you're doing a lot of physical activity, it doesn't matter if you're sweating a lot, you just can't cool off. And when you cannot cool off, you die. This is what we're seeing with the unhoused across the United States as temperatures skyrocket. We are having heat-related deaths. A lot of them are due to wet bulb temperatures. And unfortunately, not every city is making cooling stations. Some are. Raleigh does have some set up, thankfully. Even the town that Yen and I live in has them set up. But we need to see more of that. What to wear? Loose, layered clothing. For extreme heat and humidity, we recommend loose, lightweight layers of silk, lightweight merino wool, linen, lightweight woven fabrics that drape away from the body work best. High heat without high humidity is the only time we ever recommend that you wear cotton. There's a phrase that you're going to get really familiar with if you spend any time in like the prepper community, the hiking community, the camping community, medic community. Cotton kills. And it's because it holds on to moisture and it grows microbial growth when it is damp. In dry temperatures, where it's not super wet, cotton is fine. If you are going to wear cotton in high humidity temperatures, try and aim for something like cotton broadcloth, cotton canvas. It's woven differently. It allows for more of the fabric to evaporate the moisture that gets into it. Anyway, Cotton will absorb sweat. It isn't good for humid days where it can make wet bulb temperatures worse, but if it fits loosely and covers the skin, it can be good for dry, hot days. If you have to wear synthetics, which we don't recommend, look for semi-natural, lightweight synthetics like rayon, viscose, things that say moisture wicking. Look for synthetic clothing that has built-in vents so that you are getting air circulation because that fabric doesn't breathe. We recommend keeping the skin covered rather than wearing shorts and tank tops, as multiple studies have found that keeping the sun off the skin helps a person stay cool. All clothing blocks the sun's rays to some extent, but some clothing has a UPF rating. That means it was tested for how much sun protection that it provides. Look for ratings of UPF 30 and above. If you lift your sun hat up to the sky and you can see light passing through it, it is not an adequate substitution for sunscreen. You want something that you are not seeing beams of sunlight passing through. I know straw hats are really in right now. It's not effective, but you can see the sun coming through it. In hot weather, wear a hat to protect yourself from the sun. In humid weather, again, look for hats that have vents. We actually have a recommendation. Yes, they're expensive. They're phenomenal. This is a hat by REI, the Trailsmith hat. It's pretty cheap. I thought we had the other expensive recommendation up here, which is Tilly. Tilly is by far the best. We've had a phenomenal luck with them, but they're expensive, so REI has a dupe. We recommend a scarf, but in humid weather, take it off if it no longer feels cool. A scarf can be dunked in water to help you cool off, but that doesn't work in high humidity conditions. So if it's dry out, under 80% humidity, you can dunk that scarf in cold water, put it on your neck, and it'll keep you cool as it evaporates. If it's over 80% humidity, skip the scarf, it's not going to help you. Column-style garments. The absolute best clothing to wear in hot weather was determined in a study performed by researchers Richard Taylor and Virginia Finch at Harvard University and Amiran Shkolnik and Araya Barut of the University of Tel Aviv in the 1980s. They set out to empirically test what type of clothing was best suited for extreme heat. They had volunteers stand in the sun in the desert at noon wearing 4 different outfits. 2 were traditional Bedouin column-style robes. The robe is called a tobe. A tobe is a long-sleeved, ankle-length garment that can be made of linen, cotton, wool, or silk, depending on the climate and the occasion. One tobe was black, the other tobe was white. Another volunteer was dressed in a brown desert military uniform, and another was dressed in shorts. The uniform performed the absolute worst. It trapped heat and prevented the proper evaporation of sweat. The shorts performed second worst. It allowed sweat to evaporate, but didn't prevent the sun from heating the volunteer's skin or from burning it. Wearing sunblock influenced the production of sweat and made it harder for the sweat to evaporate. So although it helped prevent burning, it made it harder for the body to perform proper evaporative cooling. Unsurprisingly, the garment developed by the population that has lived in the desert for thousands of years was the most effective. The wide, long tobes allowed for air movement. The column style of the garment created a chimney effect, causing air to rise and circulate between the fabric and the skin. The tobes make the body cooler even than going out completely naked, because the shape encourages that chimney effect and artificially produces airflow even on still days where there isn't much wind. It didn't matter if the garment was black or white, as even though the black absorbed more heat, the heat didn't reach the skin. Although most people in the Western world might hesitate to wear a tobe, they can replicate the effect by wearing loose, long, flowing garments. I'm aware that this doesn't always work if you're doing something like a street action, because you still have to dress in the appropriate clothing. I wear a pair of linen or cotton broadcloth cargo pants and then a silk field shirt. That's how I do it. I think I actually had my outfit up there at one point.
Yeah, I can... Oh, for context, by the way, the first few of these photos are from a trip to Morocco, where you can see the people who live there wearing their long column garments. You can see me in layers of cotton broadcloth and linen. No, we don't have you yet.
Look, I didn't share a photo of me.
Just me.
I was dressed very similarly then. Yes, these photos were taken and shared with permission. That's why their backs were turned. They didn't want their photos, like their face in the photo. Okay. Other heat gear. Water is even more important in hot weather, in humid weather, so make sure that you have enough in your bag. We also recommend that you carry rehydration packets. Most people don't need rehydration packets to stay hydrated unless they're being exposed to extreme heat or engaging in very sweaty activity. There's actually recently a case where a person who wasn't being physically active was drinking a lot of electrolyte packets, fell into seizures, had to be taken into the ER. Happens more often than you think. If you are not sweating a lot or do not have a condition where you need extra electrolytes, you don't need a packet. But if you are going to be engaging in hot, sweaty activities, that's when to have a packet in your bag. Please look at the dosage on your electrolyte packet. There is a safe and unsafe dosage for how much electrolytes to have in a day. You can have too many. They can cause really adverse effects, including seizures. In any bag carried for high heat condition, we recommend keeping some rehydration packets for yourself and for others. Cool packs. We recommend instant cooling packs be added to the first aid equipment in a bag if a person is going to be in a high heat environment with or without high humidity as well. Generally, they have to be snapped or a clip removed to activate them. Cool packs can be placed on major arteries in the armpit, on the thigh, on the neck, on the palms, on the soles of the feet, and the cheeks. The advantage of the palms, soles, and cheeks is that they don't contract with the cold. The advantage of the other locations is it's on major arteries. A cooling neck wrap. These are soaked in water, which internal crystals absorb, and then as the water evaporates, they help cool the arteries in the neck. Again, they are not effective at high wet bulb temperatures. We also recommend potentially carrying a foldable fan, a mylar blanket, or even a portable neck air conditioner. I didn't have a slide for these, so I'm still going back and forth on what I expect you to have in your bag as a medic. But a mylar blanket is great because it can protect from any extreme heat reflecting it away from a person, and they pack down to like this big. So they're also great to hand out to the unhoused. Portable neck air conditioners, I'm going back and forth on recommending. They're also called a wearable air conditioner. It's an electronic device designed to provide personal cooling by resting around the neck and blowing cool air on it. There's also ones that can clip to your belt. I normally try and keep our recommendations under a certain cap and to things that don't require charging, switching out batteries, things like that. But I'm seeing that these are very recommended by some other medics that I'm familiar with, especially if you're going to be wearing a Tyvek suit, which as we get into next week is what you wear for mucking. So if you're going to be wearing a Tyvek suit, which don't breathe at all, then you might want to consider one of these. And it turns out that Costco has one for about $45. So, okay.
There's a physics problem there that I haven't quite figured out, but
Yeah.
that's another story.
Common heat-related injuries is what we're getting into next. Does anyone have any questions about the clothing or what I recommend you have in your bag? Yes? Yep, those are great, especially if you're gonna have a medic bag where you're going around helping people with rehydration packets, water bottles, and things, then having that so that you can also cool off someone who's showing signs of like heat exhaustion or heat stroke. Anything to get air movement. So those are great. Personally, every time I've ever bought one, it's broken on me so fast that I've stopped carrying it, and I carry a foldable fan instead, you know, like the ones you get at like Ren Fair. But if you've had good luck with them, if you know of a reliable brand, those are great. Okay. Any other questions? Common heat-related injuries. Dehydration is one of the most common conditions people suffer from in high heat conditions. Dehydration is a deficiency in the total amount of water in the body. It can be caused by not drinking enough hydrating fluids, but can also be caused by sweating, vomiting, diarrhea, ingestion of diuretics, illness, heat, and alcohol consumption. The first symptom of dehydration is thirst. Are any of you thirsty? Like right now, are you thirsty? Then you're dehydrated. That's the first symptom. The next is a dry or sticky mouth. However, it should be noted that a person can be dehydrated without experiencing thirst. Other symptoms include dark yellow urine, brown indicates severe dehydration, headache, dizziness, whiteouts or pre-syncope, which is feeling like you're about to faint, dry skin, flushed skin, and feeling cool or cold to the touch. More severe dehydration may cause decreased or even absent urine, very dark urine, tachycardia, which is an abnormal heart rhythm. In an arrhythmia, the heartbeats may be too slow, too rapid, too irregular, or too early. Rapid arrhythmias, greater than 100 beats per minute, are called tachycardias. Tachypnea, rapid, shallow breathing. Shrunken eyes, lethargy, which is a lack of energy, and syncope, which is fainting. The treatment is rehydration. If a person can drink on their own, they should. If the dehydration isn't bad, then plain water should be fine. Small sips of water over a few minutes are better than trying to chug water all at once, which can make someone sick. They can throw up. If dehydration is more severe, then a sports drink with electrolytes, an electrolyte packet added to water, that might be necessary, or an oral rehydration solution may be necessary. A simple rehydration solution is water mixed 50-50 with fruit juice with a pinch of salt. Water can also be mixed with honey or sugar, still with a pinch of salt. A simplified version of the most common rehydration solution recommended by Street Medic Collectives is 1 liter of water, 25 grams of sugar, about a handful, and 3 grams of salt, which is a decent pinch. So if you're out and you don't have measuring cups, it's a good handful of sugar and a pinch of salt. The person should rehydrate for at least 2 hours at a rate of half to 1 liter of water per hour. Dehydration often comes along with heat-related injuries, so the person should be monitored for signs of that. They should also try to keep cool using the techniques covered in that section and avoid further strenuous activity. Some cities have created cooling centers where people can retreat to escape the heat and to rehydrate. Severe dehydration can cause something called hypovolemic shock. Hypovolemic shock is a dangerous condition in which a person's heart can't get their body the blood and thus the oxygen that it needs to function. This happens when a person has lost a large amount, more than 20% of their blood volume, such as when severely dehydrated from sweating, vomiting, etc. A person can get hypovolemic shock from losing a large amount of fluids after a lot of diarrhea, vomiting, or from blood loss due to injury. Hypovolemic shock is the second most common type of shock in adults and the most common type of shock in children. Symptoms include changes in blood pressure. At first, the diastolic, which is the bottom or the second number, blood pressure increases, but as the person keeps losing fluids or blood, their systolic blood pressure at the top or the first number will also decrease. Hypovolemic shock reduces blood and thus oxygen getting to organs. That leads to organ failure. The body will prioritize getting blood to the brain and heart, which causes the rest of the body, the extremities and the organs, to be hit with oxygen loss first. This is why they go cold. There isn't blood getting to them. Hypovolemic shock has 4 stages. Stage 1, a person has lost 15% of their blood volume. If dehydration is the cause of the hypovolemic shock, the person will be showing other signs of dehydration at this point, but their blood pressure and their heart rate may still be normal. They will likely feel a little shaky and unwell. Stage 2, a person has lost 15 to 30% of their blood volume. Their heart rate will go up and they will be breathing fast, generally pretty shallowly. Their extremities may feel cool to the touch, and they may be starting to feel kind of anxious in addition to feeling unwell. Stage 3, a person has lost 30 to 40% of their blood volume. Their blood pressure will drop very low, their heart rate will be very fast, and their breathing will be very fast. Their extremities will feel cool to the touch. They will not be able to produce much urine. They may be confused. They may be weak. They may be struggling to maintain consciousness. Stage 4, a person has lost 40% or more of their blood volume. Their blood pressure will be very low, their heart rate will be very high, and their breathing will be fast and quite erratic. More of their body will feel cold to the touch, and they will not be able to produce urine, and they may pass out. Other symptoms include extreme thirst, pale or bluish skin, clammy skin, nausea, vomiting, muscle cramps, and extreme fatigue. The most important treatment for hypovolemic shock is to treat the core issue. What's causing the hypovolemic shock? If blood loss is the cause of the hypovolemic shock, the blood loss must be halted, and the person may need a blood transfusion. Hypovolemic shock should be treated by medical professionals such as EMTs or doctors. The treatment for hypovolemic shock caused by dehydration is to be removed from the dehydrating environment, the sun and the heat exposure, given IV fluids and sometimes blood pressure medications. If emergency care isn't available, slow and steady rehydration is essential. This may cause increases in blood pressure, an increased and irregular heart rate, some difficulty breathing, and a headache. Keep slowly and steadily rehydrating while preventing further fluid loss by any exertion or sweating. However, if the hypovolemic shock is severe, organ damage may already have been caused. caused, and that must be treated by a medical professional. At stage 4, even if a person receives treatment from a medical professional, hypovolemic shock can be fatal. It needs to be treated as quickly as possible. You want to prevent it from getting to stage 4. An electrolyte imbalance from dehydration can also cause seizures, which is a separate issue from hypovolemic shock, although sometimes you get both at once. Okay. Any questions on hypovolemic shock before we continue? In case you're ever curious about how does dehydration kill someone, that's one of the ways. Yes?
Is there like a recommended dosage per hour of water to rehydrate?
Yes, I read it off earlier, but I will.
Sorry.
Half a
No.
liter to 1 liter per hour.
Half a liter to 1 liter per hour. Yeah, nice slow sips. I know that when someone is really thirsty, they want to just gulp it. Vomiting will make the dehydration worse. They will lose even more of the fluid they already have. So although it's hard to restrain from drinking a lot of water when you're really thirsty, take it slowly. There's a reason why in some cases they start you with ice chips. They like work you up. Okay. Heat-related injuries. Heat stress or heat exhaustion is a syndrome of symptoms caused by heat exposure. It may worsen into heat stroke if left untreated. The symptoms include signs of dehydration, so everything from dehydration, and in addition, heat malaise, feelings of general discomfort, uneasiness, or lack of well-being. You just start feeling off. You start feeling awful. You don't, and it's like, I don't know what's wrong. I just don't feel good. Those are the phrases you're going to listen for. Nausea, headache, dizziness, flushed or pale skin, cool and clammy skin, cramps, presyncope, feeling like you're about to faint, and syncope, fainting. Orthostatic hypotension. Hypotension is a general term for low blood pressure, while orthostatic hypotension specifically refers to a drop in blood pressure when standing. So if someone stands up and they like swim, that is a sign of this.
Well, unless they normally have that.
Unless they normally have that, like Yen. And tachycardia, again, that rapid pulse. The core temperature of the person may be normal or it might be elevated. It generally stays below 105 degrees Fahrenheit, unlike in heat stroke. The care is the same for rehydration, but also requires cooling the body down. The person should rest in a cool, shady spot with circulating air. Cool packs can be placed on major arteries in the armpit, or on the thigh, or on the neck and on the palm, the soles of the feet, and the cheeks. Again, the advantage of the palm, the soles and the cheeks is that they don't contract with the cold. The advantage of the others is that it's touching directly onto an artery, and that cools the blood very quickly. They should be monitored for heat stroke until the symptoms pass. They should not return to vigorous activity. If you have already shown signs of heat exhaustion, don't cool off and then go back. Swap out with somebody else. Get someone to take your shift. Heat stroke. Heat stroke occurs when the body is no longer able to cool itself down. It is caused by extreme heat injury, too much exertion in the heat, or complicating medical conditions. Symptoms include everything that we covered for heat exhaustion, and then additionally, uncoordinated movements and impaired voluntary movement, stumbling, disorientation, abnormal posturing. So this is abnormal posturing. They can't straighten up. They're kind of swimming. This is what it looks like. They're hunched. They don't want to stand all the way up. Those are not good signs. Confusion, difficulty communicating with words, hallucinations, delirium, seizures, and coma. Seizures may occur while cooling the person down. The skin is red and hot to the touch, but in rare cases, it's very pale instead. If they are both suffering from heat stroke and severe dehydration, they're probably going to be quite pale rather than quite red. Or they might have these red spots on their cheeks, but their hands and feet will be white. Okay? It may be either dry or moist, and it is a myth that people with heat stroke will stop sweating. This occurs in less than 50% of all cases, and yet I see it on people's lists all the time. I actually made an infographic for this class because I was going to print a different person's infographic rather than make one, and I could not find a single one that did not list the absence of sweating as indicative of heat stroke versus heat exhaustion. Not one. The problem with always having this is oh, that's a sign for everyone. is that then people will assume that if someone is sweating, they're not suffering from heat stroke. If they are checking off multiple symptoms from the heat stroke list, assume heat stroke rather than heat exhaustion. It is better to assume the worst one and treat it than assume it's just heat exhaustion, and miss treating the heat stroke. Does that make sense? Okay, excellent. The person-
Also, sorry to interrupt you, we were not able to get printed copies of that infographic. However, there are QR codes scattered around the room that will take you to the link of the Canva design where you can look at it and potentially print it off yourself. We will see about getting
I'm
it
going to
printed
try
out.
and get some printed ones and bring them in here. I'm also going to be sending it out to patrons.
Yeah.
Okay. The person's temperature is often approaching or above 105 degrees Fahrenheit. Been asked before, why do you carry a thermometer in your med kit? This is one reason. Okay. Heat stroke has a high mortality rate and it is fatal if left untreated. It is extremely serious. Treatment of heat stroke cannot always be left until the arrival of the emergency medical services or until a person reaches an emergency room, because neurological damage from hyperthermia, that's being overheated, is caused not only by the maximum temperature reached, but by the duration of that maximum temperature. So, it's not only they got up to a certain temperature and they couldn't cool off, but they were there for a long time. The longer someone is at that maximum temperature, the more there's a chance of organ damage. So you shouldn't just be like, oh well, 911 was called, EMTs are on their way, they'll be fine. You need to start cooling them off right away. People should be cooled down as rapidly as possible, ideally at the first signs of heat stress before it ever gets here. The person needs to be removed from the source of heat. They should be taken to a cooler area. At minimum, the shade and shady grass or shady earth is better than shady pavement. Pavement radiates heat back at the person. Get them off of the blacktop. Get them off of the cement. Excess clothing should be loosened or removed to facilitate evaporative cooling. Obviously, don't strip someone naked without their consent, but try and loosen necklines, untuck shirts, get air movement onto their body. If possible, the person's feet should be slightly elevated to help them get their blood to their organs. They should be then doused with cool water and fanned. Cool packs can be pressed to the arteries in the underarm, the inner thigh, the neck, and, not or, and, on the palms, the bottom of the feet, and the cheeks. They should be rehydrated if conscious using a rehydration solution. Do not try to rehydrate a person who is unconscious. You can get water in their lungs, they can aspirate, that can also be deadly. Don't put water in an unconscious person's mouth. I see that in movies all the time, and it drives me up the wall. If they are hallucinating, delirious, unconscious, seizing, etc., 911 should be called while treatment for heat stroke is ongoing. Do not stop cooling the person off while waiting for EMTs. The EMTs will evacuate the person for advanced medical care. Further information on treating heat exhaustion and heat stroke injuries, such as heat edema and heat rash, can be found in other classes. We're not going to get into heat edema and heat rash today. We're going to do that probably on a rash class. Okay. Sunburn. Before we get into sunburn, questions on heat exhaustion versus heat stroke. Okay. And you all have access to the infographics, so moving on. An extremely common injury in high heat conditions is sunburn, but I want to note here that it does not have to be hot out for you to get sunburned. You can be sunburned in winter. You can be sunburned on a cloudy day. The clouds will not prevent you from getting sunburned. Sunburn is a radiation burn caused by sun exposure. Most sunburns are first degree and damage the skin's outer layer and primarily cause pain. Some are second degree and damage the middle section of the skin, the dermis, and they cause blisters as well. Third degree sunburns can occur, but they are rare, though more common amongst the unhoused. First degree sunburns heal in a few days to a week. Second degree sunburns can take weeks to heal and may require medical intervention. Third degree sunburns will always require medical intervention. Symptoms of first degree sunburn are redness on lighter skin tones, pain, the skin feeling hot or tight, tenderness, swelling, headache, fatigue, fever, nausea, and peeling skin. Generally, the peeling skin happens after a couple of days. symptoms of a second-degree sunburn are extremely red skin on lighter skin tones, pain, skin feeling hot and tight, tenderness, more severe swelling, blisters, wet-looking skin, white discoloration, fatigue, dizziness, exhaustion, confusion, fast breathing, fever, muscle cramps, headache or migraine, nausea, and shivers. It is a myth that after the burn has already appeared, it is useless to apply sunscreen. Burnt skin can and will keep burning. The burn will just keep getting worse. Ideally, wear sunscreen throughout the day and apply more throughout it. Most sunscreens need to be applied every 2 hours or every 40 minutes if a person is swimming or sweating heavily. Once home and away from heat and sun, we recommend a cool shower of at least 20 minutes duration, followed by application of preferred topical treatment. This can be calendula salve, aloe vera gel, lidocaine spray, colloidal oatmeal cream, or our preferred over-the-counter cream by First Aid Beauty, Ultra Repair Cream, which contains colloidal oatmeal. Third-degree sunburns, as mentioned, can occur. They're extremely rare. I was going to share a photo with all of you and then realized that we have not had a graphic photo talk, so at some point I get to have that with all of you. We normally do these in slightly different order, and I forgot to have it because we're out of order. Third-degree sunburns damage all the layers of the skin, including the fat layer beneath the skin, and can potentially destroy nerve endings. Most third-degree burns occur due to fire or chemicals rather than the sun. However, we personally have encountered people who are unhoused who have suffered from them. I'm going to pause here and tell you all rather a horror story, and I tell it to you for a reason. Yen and I have a very dear friend. He is an anarchist who was held as a political prisoner for many years in the American prison system. When he was released, he had issues because all of the halfway houses are Christian where he was living, which was in Las Vegas, Nevada. And all the rehabilitation programs for getting out of prison were Christian, and he is emphatically not Christian and tattooed all over his body with signs that he is not Christian. He's also professionally a tattoo artist. While unhoused after getting out of the prison system, he passed out due to the heat in Las Vegas, Nevada in the middle of summer on a 114-degree Fahrenheit day, and received third-degree sunburns from the sidewalk and lost several fingers. He's a tattoo artist. Now he can no longer use his tattoo guns without training to use a different hand. When I say that they happen more with the unhoused, it's for this reason. Someone passes out on a sidewalk, they pass out on a blacktop. That radiation burn is also then a heat burn from what's radiating out of that blacktop, that's radiating out of that sidewalk, and they get pretty bad. So if you start doing medic work with the unhoused, you may encounter third-degree burns on someone. Less likely out here than it is in Vegas. In Vegas, it's unfortunately pretty common during the summer. But here, you don't get quite so hot. I mean, in Vegas, it gets up to 120 degrees Fahrenheit in the summer. So I think we got up to 110 though here this year.
Getting there.
So we're getting there. The symptoms of third-degree sunburn include all the symptoms of a second-degree sunburn, with the addition of patches of burns that appear leathery and white, or dull areas of skin and numbness, as well as other symptoms of heat exhaustion or heat stroke. It's really rare for someone to have a third-degree sunburn and not also be suffering from heat exhaustion or heat stroke, and often it is because someone has passed out from heat stroke on a sidewalk or something that they get a third-degree sunburn. Third-degree sunburns require emergency medical treatment. Emergency medical services can be called, or the person can be taken to the ER. They may require skin grafts, where a surgeon removes dead skin and transfers healthy skin from elsewhere on the body. They cannot be treated with home remedies. I am aware of some of the sites online saying that they can be. No, they can't. You need to take someone to the ER if they have third-degree sunburns. Okay. Any questions on that before we get into sunburn relief? Cool, not cold, running water. Your first line of defense for burns should be running cool water onto your burn or take a cool bath to get the heat out of the skin. Do not bathe in hot water, as this can worsen pain and inflammation. Now this is true not just for sunburn, but also for any kind of heat-related burn while you're cooking. If you can run cool water continuously over that burn for 20 minutes, it often won't develop into a second degree burn. There have been multiple clinical studies that have found this to be true. If, for example, you ever get a really severe burn and you're waiting for EMTs to arrive, jump in the shower and stay under cool water until they get there. Now, I know that's from our burn class, not our sunburn class, but I'm throwing it in here because I don't think that people know that you can actually reduce the severity of a burn while waiting for EMTs to arrive if you can keep cool water running on it for at least 20 minutes. Okay. Aloe vera gel. One of the most commonly used treatments for burns, aloe vera is a powerhouse soother and healer. Keeping it in the fridge can up the awesome cooling powers of aloe too. Unfortunately, it is unsafe if you have a latex allergy. Any of you have a latex allergy? No one? Oh my gosh, I think that's my first time teaching a class on this where no one had one. I have a latex allergy. I can't use latex gloves, I can't use latex medical tape, and I cannot use aloe vera gel. It actually causes me to break out in a really tight, stinging rash. Now imagine finding that out on top of a really bad sunburn as a kid. Not a fun time. So find out if someone has a latex allergy before you give them aloe vera gel. Peppermint essential oil. This essential oil is antibacterial and antiseptic. It also contains menthol, which interacts with skin receptors to create a cooling sensation that relieves pain. This is a fake sensation. I just want to touch on that. It doesn't actually cool you off, it just makes you feel like you're getting cooled off, which is why I got in a fight with a medic collective at one point. Because they said treatment for heat exhaustion would be to mist the back of someone's neck with peppermint essential oil. And I was like, no, cold pack on the back of the neck. Cold pack. And they were like, well, it does the same thing. No, it emphatically does not. It's like how capsaicin triggers the pain in your tongue. It triggers the nerve sensation of coldness. It does not actually cool you down. Now, drinking peppermint tea actually does have a refrigerant effect on the body and can lower body temperature, but only by a couple of degrees. However, there is a reason why in Morocco they will just keep giving you cups of green tea when it's hot out. Okay, anyway. Also, just so you know, in the mouth, capsaicin and mint are triggered by two different sensors, so you can't cancel one out with the other. Anyway. However, I know what you're thinking of. However, it is absolutely crucial to dilute the peppermint essential oil in a skin-safe carrier oil. This is olive, coconut, argan, jojoba. Do not apply essential oils directly to the skin undiluted ever. I don't care what doTERRA tells you. I don't care what's the other company, Young Living tells you. It is not safe. Do not eat them, do not drink them, do not apply them to your skin undiluted. Absolutely not. And I cannot even tell you how many websites have unsafe dilution instructions online. We prefer diluting it in calendula-infused jojoba oil. Peppermint essential oil can be 0.5% of the total weight of the amount of carrier oil used, which is a lot less than you think it is. Lavender essential oil. Lavender essential oil is said to have many amazing healing benefits when it comes to skin and burns. Not only is it analgesic, helping to relieve pain, but lavender is also able to regenerate cell tissue and minimize scarring. This all-purpose essential oil has been used for centuries to heal and lessen pain, but again, it still has to be diluted. I have been told by other medics that lavender is the one oil you can put on your skin undiluted. No. We prefer to do it again in calendula-infused jojoba oil. Lavender essential oil can be 0.5 to 1% of the total weight of the amount of carrier oil used. Silver sulfadiazine cream. Silver sulfadiazine cream is an antibiotic used in burn centers all across the country as an effective treatment for second and third degree sunburns. Unfortunately, it does require a prescription. This is one of the things that my grandmother would get from out of the country and bring into the country for working with the unhoused. That was illegal. That's drug smuggling. Giving it to the unhoused violated the legal standards of operating as a street medic. Grandma didn't care. So it's on here for a reason, and I'll leave it there. Plantain, not the fruit. One plantain, Plantago species, is an herbaceous plant in the family Plantaginaceae, while the other, Musa ex paradisiaca, is a starchy fruit that looks similar to a banana. This plant is often thought of as a weed in North America, but it's been hailed by some of the First Nations people of America and also Alexander the Great as being a miracle worker for burns, bug bites, and stings. A strong infusion of plantain sprayed onto a sunburn can help soothe and heal it faster. Plantain contains a compound called allotonin, an anti-inflammatory phytochemical that speeds wound healing and stimulates the growth of new skin cells. We have a plantain that grows all over here. It's Plantago lanceolata. It is literally considered like a weed. It's everywhere in North Carolina. My backyard's full of it. So it's not something you even need to buy. If you learn how to recognize it, you can harvest all you need all summer long. Okay. Calendula tincture or infusion. Calendula is very effective at healing many different skin conditions. You can use the herb to make an oil infusion or a hot water infusion. Recipes will be included at the end of these notes. And apply it to a burn in a cold compress. Don't put hot compresses on burns. Cold compresses only. Hot compresses will worsen the inflammation. Colloidal oatmeal. Colloidal, meaning finely ground, oatmeal moisturizes, helps protect the skin barrier, and also has anti-inflammatory properties. Colloidal oatmeal has been shown to promote skin repair after environmental insults, aka sunburn. It can be added to a cool bath to soothe large patches of sunburn and relieve the discomfort of dry and flaky skin. If you're already at like the peeling stage of the sunburn, that's a great time to take a colloidal oatmeal bath. It is often an ingredient in repair and burn creams, including our favorite by First Aid Beauty. Raw honey. Raw honey is an effective antimicrobial and anti-inflammatory. However, for large patches of burn, I find it sticky and unpleasant. It's really effective if you have a small area of burn, like where it's like right here or something. Just, take it off before you lay on your pillow. Cool milk. Cool milk compresses can be used to relieve the pain of sunburns. It can create a protective protein film on the skin. Milk also contains lactic acid, which acts as a gentle exfoliant and helps remove dead skin cells. It also has antioxidants that can help reduce the inflammation of the sunburn. Vitamin E oil. Some limited research may suggest that vitamin E oil can prevent or reduce the formation of sunburn. It can also moisturize dry and flaky skin and help relieve the itching and the burning once you've already gotten one. Not enough research. Baking soda. Baking soda added to a cool bath is often recommended by herbalists online for relieving pain and soreness from a nasty burn. However, there is inadequate scientific study for us to recommend it. Anecdotally, some people find it effective. If you want to try it, you would add a quarter to a half a cup of baking soda to your bath and submerge your burn. Don't do this for longer than 20 to 30 minutes to prevent over-drying the burn. Pat the body dry and gently apply a moisturizing salve to your skin after the bath. Personally, I don't find it effective. Tested it a couple times. It's not what I prefer. I prefer a colloidal oatmeal bath, and there isn't enough research one way or another, in my personal opinion. Things we emphatically do not recommend. Apple cider vinegar. Apple cider vinegar is sometimes suggested as a home remedy for sunburn. However, scientific evidence is lacking to support these claims, and many dermatologists advise against using it on sunburned skin. They say it dries it out and actually makes the problem worse. Colloidal silver cream. This is different from colloidal oatmeal cream or silver sulfadiazine cream. Colloidal silver cream, when applied to the skin, is likely unsafe, and in high frequent doses it can lead to a permanent bluish color in your skin. There also isn't sufficient scientific evidence that it's at all helpful for sunburns, and yet I find it on everyone's list. And I'm like, or you could recommend the one that's actually used in burn centers. Sea salt baths. Despite online herbalists recommending sea salt baths to people for burns, scientific studies have found that they irritate the skin and damage it further. Additionally, one study found that soaking the skin with salt solutions increases the sun's sensitivity to subsequent UVB radiation. So it actually not only hurts the burn and makes it worse, but it sensitizes the skin so that the next time you go out in the sun, you're more likely to get burned again. So this is like opposite world. You do not want to do that. Okay. Medication issues. Caution, some medications can increase heat sensitivity. These include, but are not limited to, diuretics. These increase urine production and can contribute to fluid loss and dehydration. Make sure to stay extra hydrated unless it is contraindicated for you to do so. Some people are on diuretics to prevent heart attacks, in which case they have to be very careful how much additional hydration they have. So again, if it's contraindicated for you, then probably just don't get into a dehydrating environment. Anticholinergics. These decrease sweating. The body relies on sweating to cool down, so take extra caution to stay cool. Consider adding a damp cloth to the neck. Beta blockers. These restrict blood flow to the skin and may reduce a person's ability to cool down. Take extra caution. Antidepressants. Some antidepressants affect the regulation of body temperature and or impair the ability of the body to sweat. Take extra caution to stay cool and consider adding a damp cloth to your pack and having it ready for your neck. Caution! Some medications may increase sun sensitivity. These include, but are not limited to, antibiotics. The sun's UV rays trigger certain compounds contained in these medications to react and cause structural changes in the drug. These changes cause the production of antibodies that are responsible for the sun sensitivity reaction, which can include an allergic reaction or severe sunburns. Cover the skin with extra sunscreen, or wear UV blocking clothing. Non-steroidal anti-inflammatory drugs, NSAIDs. UV rays, again, trigger certain compounds contained in these medications to react and cause a structural change in that drug, which can lead to sunburn and blisters. You need to take extra care, wear sunscreen, cover your skin. Diuretics. These also increase the risk of sunburn, not just dehydration. Again, cover up. Antidepressants. Certain classes of antidepressants, including the tricyclics, can also lead to increased UV sensitivity. Cover the skin. Oral contraceptives. Some, but not all, people on oral contraceptives may develop increased sun sensitivity. It varies by person. That one's not always, it's sometimes. Again, cover up. Retinoids. So if you're on retinol A, tretinoin, things like that, they increase sensitivity to UV light and it can increase the chances of sunburn. Caution! Some medications may be affected by sun and heat exposure in other ways. Topical clonidine and fentanyl both are absorbed through blood vessels on the surface of the skin. Heat and sun can cause those blood vessels to dilate, which may mean that you get a larger dose than intended. So please be cautious. Please note that this is not a comprehensive list and that you should research any medication you are taking and how it may affect you when you are exposed to increased sun and heat, because it's going to be different based on what medications you're on and what combinations of medications you're on, because they have combinatory effects. Okay, and then we get into recipe making.
I'm going to add a quick note that there are some herbal preparations that we recommend for some purposes that also increase sun sensitivity. We will talk about those when we get to those in other classes.
Right, like if you're taking an anticholinergic topical ointment from us, you need to be cautious that you're going to absorb too much of it if your skin is dilated, for example.
If you're taking rue for any reason.
Ooh, yeah. Herbalism for AFAB autonomy. If you are ingesting rue, you are going to be really sun sensitive for a while. Like, as in, it can cause you to blister when you go out in the sun. So, just be aware that herbs also can cause this. Because remember, herbs are also drugs. Alright. While we're still recording, questions, comments, snark?
Okay.
Alrighty.
So we are going to